What's up, everybody? Mike Pismarov here, and today we're going to be talking about your discs. Not these discs, but these discs. One of the first things you need to know about discs is, well, everybody has them. Here's your spine, and these white things are your vertebrae, and between these adjacent vertebrae are your intervertebral discs, and that's exactly what we're going to be talking about today. Everybody refers to these things as jelly donuts. Well, they're a ton tougher than jelly donuts, but they serve as a good analogy to help people visualize what's actually going on. Now, ironically, I actually went and got jelly donuts because I knew we were going to be doing this intro. The inner area here is known as the nucleus pulposus, and this is the actual shock absorber portion of the disc. Now, the outer portion is a tough, fibrous, structural portion, which actually helps give the disc support. This helps you handle a lot of different types of pressures, whether it be walking, sitting, jumping, skipping, dancing, flipping. Anything you do, these discs get pressure. When continuous pressure or overpressure is placed on the tissues for prolonged periods of time, or there's an acute, which means an immediate overexertion of pressure on these discs, and it's too much for these things to handle, the discs will. Now, I know what you're thinking. I better be careful, I better not go do anything fun, otherwise my discs are just going to spontaneously explode and then I'm going to be debilitated forever. Well, not really. A lot of people think that disc protrusions, disc bulge, disc extrusion, sequestration, direct cause and effect relationship to pain. But it really doesn't. A systematic literature review done by Walid, I'm not going to say your last name, that begins with a B, et al., and everybody that helped him out, did a lit review on patient populations who have zero pain whatsoever and still have disc bulges. 30% of 20-year-olds, 40% of 30-year-olds, 50% of 40-year-olds, 60% of 50-year-olds, 69% of 60-year-olds, 77% of 70-year-olds all had disc bulges or protrusions or some type of disc pathology without pain, which is interesting because what does it tell us about these bulges, protrusions, extrusions, etc.? What does it say? It's just part of the normal aging process. And although in some cases these can cause pain, it's not always a cause and effect. In truth, spinal-related disorders are multifactorial, biopsychosocial phenomenon that should be first treated with aggressive conservative care. I'm pretty sure that's an oxymoron. Aggressive conservative care. Yeah, you should be aggressive with being conservative, right? Don't do surgery first. Okay, if you have pain, conservative options help reduce some of those complicating factors that may not be related to those discs. Also, it might help improve your quality of life and reduce the amount of pain and suffering you're actually dealing with.